Good evening, and you are welcome to Health Check tonight. My name is Grace Mutiso. Now, addiction can take many forms. It runs from substance abuse, compulsive behavior, and beyond. Now, it can take affect anyone. It can affect anyone regardless of their gender, their age, and it comes with so much different consequences. And this affects an individual and also affects the family. Tonight on Health Check, I'm hosting Michael Ondachi, an addiction counselor, ready to take us through this topic and how to prevent and manage relapse, whether it's alcohol or drug abuse. And we invite you to be part of our discussion tonight. Our SMS line is 22232, that is 22232. You can also engage with us. Our WhatsApp line is 0708 22232. Remember, this conversation is live on Facebook and YouTube. Our handle is at Hope TV Kenya. Good evening. I'm so glad that you found time to join us on Health Check tonight. My name is Grace Mutiso, and allow us to get straight to our discussion tonight about preventing and managing relapse. So engage with us again if you have any question or comment. Allow me to introduce Michael to us. Michael, how have you been?
I've been good. How are you, Grace? It's been a minute.
Yeah.
Yeah.
Were we together last year or this year?
It was last year, around November, I think.
Wow.
Yeah.
Okay, not so far.
Okay. So that's Istanbul, is it?
Yeah. Okay.
Yeah.
Good. So, to set the ball rolling, let's begin by defining what's addiction, because before you get to relapse, you must be relapsing from something. So let's define addiction first.
Yeah, so basically addiction is defined as a chronic brain relapsing disease. And we have different forms of addiction. We have basically what we measure with for the space that I'm in currently is substance use disorders. Substance includes anything that we call psychoactive, things that mess around with how your brain functions.
Yes.
And this includes alcohol, this includes marijuana, this includes cat, what you call miraa, this includes heroin, cocaine. Those are the major things that we deal with. And we also have what we call process addictions. And process addictions can be things like gaming, things like gambling, things like pornography, things like masturbation. These are compulsive behaviors that may be excluded. Even shopping.
Oh, really? Shopping?
Yeah, that's another one.
Oh, no.
People who shop compulsively.
Yes.
And that is also a problem. So basically what we measure in the space that I'm in is substance use disorders.
Okay. What would cause someone to abuse substance?
Interesting question. You see, substance, we call them drugs.
Yes.
And basically what a drug is something that is used to treat something, like medication, right? So one of the things that push people to use drugs is there's usually an underlying problem. People don't just take drugs for the sake of taking drugs, especially when it comes to a point where they get to compulsive use. When we do our treatment plan formulation, we usually look for or scan for what we call the underlying issues. People go through difficult life issues that may start all the way from early childhood. There's what we call advanced childhood experiences. We call them ACE. Maybe someone went through trauma. Maybe someone was raised in a dysfunctional family. You know, maybe someone came from a background that was really unstable and also got exposed to these substances. The other thing that we talk about is what we call the X factor. The X factor simply tells you that addiction runs in families. It's a genetic predisposition. So you get in the family tree, if you're to navigate maybe from the grandparents, the great grandparents, all the way to the uncles, or some of these relatives, you'll always spot someone who had one of these problems. So that's another factor that predisposes people to addiction.
Wow. Wow, interesting. So let's now define relapse. What is relapse?
Wow, relapse in relation to substance use disorders or compulsive use of substances basically tells you that someone had gone clean or was able to abstain, stay away from their substance of use, what we call drug of choice, for a period of time successfully and then going back to it after a period of time. That is basically what you call a drug relapse or relapse back to drug addictions.
So you stopped at some point and you find yourself going back.
Yes.
So what could cause someone to go back?
Wow. First, we need to understand exactly what relapse is.
Yes.
Right? So relapse is not necessarily an event. It is both an event and a process. There are different stages to relapse. And the first stage to relapse is what we call the emotional stage
Yes.
of relapse. The second one, we call it the mental stage of relapse. And the third one is now the physical stage of relapse. Now, when you come to what we call relapse as per definition of the layman, is when someone goes back to the
Yes.
drink,
Yes.
like, or when you find yourself lighting a cigarette, or someone passes you a blunt or weed and you end up smoking. That's not relapse. That is just the physical manifestation of it. This thing already transpired way before that.
Okay.
So the first stage of relapse is what we call the emotional stage. Your emotions, what are you feeling? What is your internal environment looking like? And then whatever it is that you're going through emotionally is going to trigger thoughts. And then these thoughts now will drive you into action. So the first stage is usually what we call what are you experiencing emotionally? Things like irritability,
Yes.
things like anger, things like anxiety, things like you don't feel like you want to be with people, you just want to be in your own presence, isolating. These are factors that will make you start thinking, because there is a problem that needs a solution.
Yes.
And the solution is self-medication. So you get people end up going back to the substance because there's something they need to treat.
Yes.
And by the time someone now starts actively thinking, like, there are things that we call triggers. And a trigger is what activates the situation. Like, when you pull the trigger, it's not that trigger that is going to kill you. There's a flow of events that is actually going to lead to you catching a bullet.
Yes.
Later.
Yes.
So the trigger situations are what will trigger this kind of emotions. Maybe it can be even both positive and negative situations, like even music. For me, I think music is one of the biggest triggers, because
Really?
you can listen to a certain type of song and it takes you places, and you're like, wait a minute, this song can feel way better, if only I had this and this. And that already shows that there's something underlying that was already negative, because you're being in recovery means that you have there's like a part of you
Yes.
that has been taken away in regards to addiction.
Okay.
Let me just expound that a little bit more.
Yes.
In
Still on the emotional bit.
Yes.
Okay.
Still on the emotional bit.
Yeah.
In regards to what substance does to people, and part of definition of what addiction is. You see, people get addicted to substance because it makes you feel good. It gives you that good vibe, but with time it ends up destroying you. So usually this substance is going to be connected to, or to be related to, a positive attribute in your life. It's just that in the long term it ends up destroying you. So there'll be that emotion that will come to you and you'll be like, wait a minute, I know this kind of emotion, and there's something that can be able to pull me out of it.
Yes.
You understand?
Yes.
And this something that you're being pulled out of it is a form of a treatment which had become a part of you for the long time.
Yes.
Because when you're defining addiction, you're looking, what is addiction? Addiction means that you use this thing compulsively. We look at compulsion compulsively, which means it's compulsory. It's a must for you to use this substance.
You can do without it.
You cannot do without it. it's compulsive. The other thing that we look at is obsession.
Yes.
It's either you're doing it or you're thinking about it. It becomes priority in your life that if this thing, it's either I'm on it or I'm planning to get it.
Yes.
And then there's loss of control. You're not able to manage any situation. You're not able to cope in any situation without this thing.
Okay.
And this thing has rewritten how your brain functions. The normal thing is to wake up in the morning and to have breakfast.
Yes.
Right? Or
Yes.
take a shower, then have breakfast,
Yes.
and then go to school,
Yes.
or go to work, and then invest yourself. Then at the end of the day, you get rewarded. But this thing, you're rewarding yourself first thing in the morning. You know, for chronic alcoholics, sometimes when they black out, and then you forgot, maybe there's a stash that you left under your bed. You know, you don't. The moment an alcoholic wakes up, usually does like this. The moment he touches this bottle like this, his eyes pop up and there's already some sort of relief.
Okay.
You know, that's emotion already. There's a connection
Yes.
just by him getting the affirmation that this thing is here and I can hit it. Or maybe it's a blunt, someone who smokes weed. The moment you are sure that it's close to you, then you're on it. So it has become a part of who you are for the longest time. And here you're being told that you need to discard of this thing.
Okay.
And become someone completely and totally different. So that's where the challenge comes in. Because when you look at, there are two types of people in recovery.
Yes.
Two types of people. There's what we call the denied user. And then there's who we call the non-user.
What's the difference between the two?
A denied user is someone who does not smoke or drink or take whatever drug of choice that they had been taking because the situation has denied.
For example, they don't have the money to buy it.
Not necessarily.
Yeah.
Because the doctors told you your liver is going.
Ah.
It's because your officers told you we're going to fire you.
Yes.
It's because your parents have told you you're not going to live in this house and behave like this. It's because school has demanded, you know, it's because the situation has demanded for you to style up or for you to get out of this thing. So someone's kind of hesitant, okay, I'll do it. I'll do it so that I can at least not get the consequences, the negative outcome of it. So that's a denied user. Then we have the non-user. The non-user gets to realize that, yes, we had a party, we had a good time, you know, the flow was nice and all this and all that, but it has come to a point where I need to grow. I need to transition to my next season of this life. I can no longer continue doing this thing. First of all, I'm sick. I'm not okay because I can't continue entertaining this kind of sickness because it's going to take my life away. Those are the differences. Now, the challenge is someone that is a denied user is someone that is in a chronic state of mental relapse, meaning they're thinking about it, meaning they have what we call euphoric recalls. They remember the party, they remember the lights, they remember the music, they remember the vibe, they remember the story and all of these things. They remember how good it felt. That's the chronic state of mental relapse. And anyone in early recovery is 1 to 2 years.
Yeah. Oh, it's not months.
No, it's not months. It's 1
to 2 years.
to 2 years. So anyone in early recovery is in a chronic state of mental relapse. They are called denied users.
Okay. You know, before we got to these two definitions, you had mentioned emotional, be it plays a key part towards somebody relapsing, and you'd also mentioned mental. Could you talk about mental before the physical one, that everybody thinks now this person is back to alcoholism or drug abuse? So what happens in the mental state of this person for them to relapse?
Mental relapse basically is now what you call the euphoric recalls, because now you're thinking. You start minimizing. Minimizing means just downplaying the consequences of where you were before. You start rationalizing. Rationalizing is saying it wasn't that bad. You know, you try to justify it. You try to explain it. You understand? You try to kind of look at the positive side of addiction more than the negative consequences that actually took you there. You actually start missing your friends. Because, sorry, I didn't explain this earlier. When it comes to triggers, we talk of PPTs.
Yes.
PPTs are people, places, and things. And we usually start with people
Yes.
because people will definitely influence you. The company that you keep basically defines you. Like it said, show me your friends,
Yes.
right? Yeah, now we say, show me your friends, I show you your destiny, or show me your friends, I show you your future. So basically, the company that you keep, sometimes I am in recovery. We always
Yes.
say that you are in recovery.
Yes.
And you tend to miss the crowd. You know, like if you're to take the substance by yourself, you won't catch the vibe as much as you will be in a crowd. So in mental relapse, people end up missing the crowd. So you can say, let me just go to the bar, I'll drink a Del Monte, you know, I'll just listen to the music, I'll just hang out and feel how these guys are and stuff like that. You're already thinking about it, you know. So the more you think long enough, then you end up acting. You just don't go and order a drink. Like if you put this, let's say this water was hard liquor for me, you know, I'd really, it really, I can't take it
Yeah.
because it's not in me. I've not been preoccupied thinking and ruminating. They're called ruminating thoughts
Yes.
in regards to consuming whatever it is that I've been, you know, secretly harboring mentally.
Okay. And I like what you've said that you need to watch out for the people, because the next question I wanted to ask you is what are some of the triggers, people, places,
Things.
and things? Yeah. So you've talked about people, you've talked about places. What about things? The T.
The T is basically there's what we call paraphernalia. Paraphernalia. Maybe there's this famous musician who is well known for smoking weed, you know, or maybe there's this particular jacket that if you put on this jacket, you just know that you're not coming home until kesho kutwa. You know, it's party after party. There's what we call there's some people who roll their joints using some kind of they call it a flag, right? Uh, people have how do you call this, kiko? You know, like these pipes, you know, for smoking whatever it is they smoke. Some have these pipes for shisha, right? Some have these bottles maybe for expensive drinks that they put in their house, what you call decanters, you know, like it's not labeled, so you can just put your drink over there. Those are some of the things that we talk about. And maybe just to go back to the people being the biggest trigger,
Yes.
the first person is
Yourself.
it's yourself. It's yourself, and that is very much important for people to be aware about. We can environment is secondary, you know, like places that's secondary, things that's secondary. But if the person themselves are not self-aware, and that's the biggest issue.
Okay. And I'm sure as you're talking, you're picking up some things and you're saying, this sounds familiar. Maybe I know a loved one who is in it, or yourself, you're in it. Do you have any question? Talk to us. Our SMS line is 22232. That is 22232. You can also WhatsApp us. The numbers are right at the bottom of your screen. And you can also talk to us at Hope TV Kenya on Facebook and YouTube. I'm sure Michael Ondachi, our very able addiction counselor, will be glad to address your question or your comment this evening. Our topic for today is preventing and managing relapse, especially from alcohol and drug addictions. Now, what are some of the telltale signs, you know, that as a person, because you said the most important person is you, who's getting out of addiction, and also people around you, you know, your loved ones, look out for as a sign that this is a warning sign, this person could be relapsing?
There are stages. There's the same way there are stages to relapse. There's also what we call stages of recovery. Now, in the stages of recovery, there's now what you call the early stage of recovery. And the early stage of recovery is what you call the abstinence stage. Abstinence simply means that you're not using, that you're no longer consuming whatever it is that you're consuming. And this is usually between the first and the second year of recovery. Now, in the first to second years of recovery, there's what we call post-acute withdrawal syndrome. Post-acute withdrawal syndrome is acronym in capital PAWS.
Pause.
Like this thing is going to grab you. Like there
Yeah.
are pulls from the past
Yes.
that tend to grab you. Now, we have what we call the acute withdrawal syndrome. A syndrome basically is a profile of many symptoms, right? Like if you get someone like who's a chronic alcoholic, you just grab the drink away from him without any sort of intervention. You understand? He's
Yes.
going to go through things.
Yes.
He'll not be able to sleep at night. You know, that's insomnia. He's going to start hallucinating. He's going to start hearing voices. He's going to feel like things are crawling. He's going to have nightmares. He's going to have night sweats. It's bad. Some people actually die because of that. They're bad for people, especially on hard drugs like heroin. It's pain. You get like cramps. It's terrible. That's what we call acute withdrawal, and it's different for different drugs. Like acute withdrawal syndrome is not the same for the person who takes marijuana for the person who takes alcohol. It's different. But now, when we come to post-acute withdrawal, that means post-acute, and it's taken some time,
Yeah.
right? And this will come after you stop using. It will come between 1 to 2 years, and this combines both the emotional and the mental states or stages of relapse, whereby you wake up one morning and you just feel irritable. You have mood swings. You feel like you don't want to be with people. You want to isolate. There are bouts of depression where you feel, this what life is not worth living. I'd rather be by myself. People hate me. People don't like me, and things like that.
Yeah.
So this usually happens within 1 to 2 years, but with time, it tends to get better. It tends to get better. So what we try and build at this stage, the initial stage of relapse prevention, we talk about self-care.
Yes.
The moment you start realizing that you don't want to socialize, the moment you start seeing a family member starting to withdraw, you know, like you're having dinner at the dinner table and he's not showing up on the dinner table, or when he doesn't feel like he wants to talk to people, those are already signs. These are telltale signs that this person is already, when people fail to be accountable, I can't tell you where I was last night, you know, or I came home late and I can't really tell you what was happening. These are telltale signs. Like there's a break in consistency of what they've been previously doing. When people start lying, when people start, you know, you can pick maybe some scent. They're trying maybe to cover something. Maybe they have had a slip. We have what you call a lapse apart from the relapse,
Yes.
like an oops. Maybe you found yourself in an environment where you really couldn't resist, but you see, technically, this thing has already been going on in your mind.
Yeah.
If you're still in early recovery, that is between 1 to 2 years. So those are things that we need to look at.
And that's for yourself and also for your loved ones
Yes.
to watch out for. So what's the first thing that one should do when I notice these are telltale signs I'm experiencing? So what's the first thing to do to be able to pause it before it gets to a worst state?
Yeah. Let me not talk in general. Let me talk in regards to what we practice as an
Yes.
institution
Yes.
and what I've also been taught in regards to intervention. Treatment is long term. Basically, like when you're crafting your treatment plan or when you're doing your treatment plan formulation, there are things that you look at. There are things that you look at, and there's what we call someone that is coming into treatment, right? Because it's long term, including the relapse prevention and aftercare and follow-ups and interventions and things like that. Yes. So when someone is coming into treatment, first we look at what we call a case conceptualization. So in a case conceptualization, usually you try and craft it between the time of admission to the next 2 weeks, because there are some investigations that you need to navigate through. So there's what we call the presenting problem. A presenting problem is, why does the family or whoever is committing this person into treatment feel like they really have a problem? You know, so the presenting issues are usually like probably excessive drinking, not going to work, maybe acts of violence, lack of personal hygiene. It's a whole profile that happens. So you look at what is the presenting problem. And then from there, you look at what is the predisposing factor. Predisposing factor, we talk of family genetics,
Yes.
right? We talk of environmental factors, maybe from early childhood, this person was traumatized and him taking substances just as a form of coping mechanism, right? Then from there, we talk precipitating factors. What are the triggers? Is it the environment? Is it money? Because there are some people who cannot stay with money in their pockets. Pesa wina kuna kiwawasha. Ezika hivi.
Yeah.
Like body language changes. You know, like when these people even check into a bar like this, people just know. Utaitwa mkubwa ama mzito.
Yeah.
You know,
Yeah.
there's those words. So what is the precipitating factor?
Yes.
And then from there, what is the perpetuating factor? Maybe this person has been in treatment before. What is it that keeps this problem going? What's the perpetuating factor? Maybe it's family dynamics because people come from dysfunctional families. Maybe it's an intense working environment. You know, there are things like that. And then we look at the protective factors. Protective factors, maybe this person loves their kids so much that they sacrifice anything for that. Maybe they are good academically. Maybe they have a wonderful career that they are willing to protect. You know, maybe the family is very supportive. Maybe the sisters and the brother, the parents are very loving and caring. So that's what we call the protective factors.
Yes.
Now, that aside, there's what we call the multi-axial, right?
That's a big word.
Multi-axial. There's a document, we call it the Bible of treating mental illnesses. It's called the DSM, Diagnostic Statistical Manual of Mental Illnesses. So there's DSM-4. This is the criteria that you use for crafting now the treatment. So there's Axis 1, which talks about, basically it's an alcohol use disorder, right? But people don't just have an alcohol use disorder.
Yes.
Someone is probably trying to treat depression, right? So we have it in Axis 1, depression, stroke, alcohol use disorder. Or someone has been smoking weed that has given them a mental disorder. So there's something we call drug-induced psychosis,
Yes.
right? Then there's Axis 2, which basically talks of any body problem that I won't major about right now. Axis 2 actually talks about any personality disorders. Axis 3, any bodily problem. And then there's Axis 4. Axis 4, now, that's where we major. Does he have legal problems? Does he have occupational problems? Does he have economic problems? Does he have problems with family support and things like that? So the moment you have all this,
Yes.
then when it comes to your treatment plan formulation, after you've looked at all the modalities of psychotherapy, maybe pharmacotherapy, maybe psychiatric assessment and reviews, there's what you call exit planning.
Yes.
Exit planning is now when you're letting this person go back to the normal home environment. And when they're going back to the normal home environment, then there's some structures that need to be put in regards to family support structures.
Okay.
Is he going to, because he needs to be occupied.
Yeah.
He's idle also for too long. That's another problem.
Okay. I'll have to go on a break. When you come back, I'd want us to dive deep into now the support, you know, that this person needs to get from the family as you're sending them back home towards recovery. You're on Health Check right here, Top TV. Look and live. My name is Grace Mutiso. I'm hosting Michael Ondachi. He's an addiction counselor, our guest today, as we discuss this topic, preventing and managing relapse, especially alcohol and drug abuse. If you have any question, please send them to us. Our SMS line is, and the WhatsApp line is at the bottom of the screen, or you can go to the comment section on Facebook and YouTube at Top TV Kenya. We'll be sampling your questions and comments when we come back. Keep it right here. We'll be back after this short break.
Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station with footprints across the country. Tune in to Hope TV, where you look and live. Every Wednesday at 7:30 p.m. Spotlight.
Do you feel like they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking.
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi. Hope TV is now available on GoTV Channel 103, Zuku Channel 873, Signet Channel 817, and StarTimes Channel 026. Enjoy our uplifting content and family-friendly programming anytime. Hope TV, you look and live.
Only God can turn a mess into a message.
I have a boy on a wheelchair.
Yeah.
I'm still preaching on the pulpit.
Amen. Niliona mguu ya nyuma inakuja tu kunikanyaga imenilenga tu kwa tumbo. Nikaitana tu Jesus.
I got tired of working with the x-ray papers and one day I just woke up and decided to burn them.
A test into a testimony.
The whole community didn't want to hear that anybody is born again. Excommunicated straight.
Bila Yesu hakuna njia.
Join Sharon Naitore Wangenye on Testify.
Katika hiyo harakati hiyo spirit ikakemewa, mimi nimeona Yesu Kristo namna hii. Kwa msalaba. Opa. Hallelujah. Hallelujah.
Every Thursday at 8 p.m. for a moment to grow your faith some more.
Welcome back to Health Check right here, Top TV Look and Live. I'm glad that you're still with us. My name is Grace Mutiso, and I'm hosting Michael Ondachi, an addiction counselor, with us this evening as we discuss preventing and managing relapse. And of course, this is the last segment of the show where we'll be looking at your questions and comments at Hope TV Kenya on our WhatsApp line and SMS line. They are right at the bottom of your screen. You can be able to send them in a short while. I'll be sampling them and, of course, asking Michael to give us some wisdom regarding that. So we stopped at that point where you're saying this person has been to rehab. I assume you've done all the tests, for lack of a better word, you know, to help identify what are the issues that are causing relapse. Now you're sending them back home, and they need to have a support system to help them continue with the recovery. So what's the role of the family towards helping an addict recover?
Right. During the inpatient program, assuming the person was an inpatient, there's what we call family therapy sessions. So family therapy sessions usually invite the family to come over so that you can have some conversations in regards to what has been happening during treatment, and they also get to get feedback from their loved ones during that season of treatment. And there's what we call psychoeducation.
Yes.
And psychoeducation is usually we empower the family to understand that this person has not necessarily been morally deficient or just a general lack of discipline, of which also those are tagged along somewhere. But basically for them to understand that this has been a patient. In other words, this person has not been well. This person has been suffering. What we call addiction, which comes with a whole profile of defects of character, and I put it in quotes, moral deficiencies. So in regards to making amends with family, first of all, in regards to what maybe the patient fell short of doing, in regards to expectations and things like that. So first of all, we make the amends at a formal level, so that the person is not discriminated, the person is not judged, the person gets the right support. And of course, the person included also, they have a role to play, not just the family. But the family, first of all, is the family will not trust you.
That's the reality. Oh.
Family will not trust you.
Why? At least you've practiced it, you've seen.
Because
why is that?
Because you've consistently failed them and yourself. Yeah. And the worst thing is, even the person in alcoholism, they promise themselves like, me, I'll never drink again.
Yeah.
Me, I'm done. But then you wake up tomorrow and you're like, yeah, just one more. Yeah. And then you end up going back and back and back again. So what I usually tell people is when you get committed to treatment by your family, what family usually have is hope.
Yes.
But they don't have faith. There's hope. Because first it's hope.
Yes.
Right? And then faith. Because faith is the substance of things not seen. The evidence of things hoped for. Right? So this hope family has. But for this hope to mature into faith, it is now for the individual included to work that.
Yes.
Right? And then once you have faith, then this faith metamorphosizes into trust. And then after trust, then people surrender. They'll be, now this one is secure. This one you can leave him alone.
Can't relapse again.
This one is okay.
Yes.
So in terms of early recovery, this person has to be accountable, because there are very many promises that they'll make during their time of treatment. I have changed. I'm going to go back to school. I'm going to go back to work. I'm going to do so. The best the family can do is support this person, but accountability is primary. Accountability is priority.
When you talk about accountability, Michael, accountability to who? Is it to the counselor they're working with, to the family, or they need a specific person? Or to themselves? Of course, you can't be accountable to yourself.
Yeah, of course.
Yeah.
Basically, this is now from the family's angle.
Okay.
But for the facility that I work for, which is Dove Mental Health Hospital, when we craft a treatment plan formulation in regards to exit plan and support structures, it's not just family support structures, even us. So when we are letting a person go, we usually give them what we call dates of review.
Yes.
So for someone who is basically does not have a comorbid or a co-occurring disorder, maybe this is a person who's been struggling with substance, maybe depression.
Yes.
Or maybe marijuana and schizophrenia, or bipolar, or something of the sort, and they are not on any medication, right? If someone has not been having a co-occurring, like it's a purely alcoholic problem, right? That one will give you a review date of 2 weeks. We'll give you a review date of 2 weeks for the first 2 months.
Yes.
You come after every 2 weeks, then we see you're stable. Then coming into the 3rd month, then you can give you some time. Maybe you can come in once in a month. And then we are also talking to your people, and me as your therapist, I'm also directly connected to you.
Yes.
And this we do for a period of even up to 2 years. Make sure that this you're not gonna get grabbed
No
back. So we need to be very aware and conscious of that. But for people who may necessarily be on medication, it can be sooner. It can be even on a weekly review date, and then tapering it slowly into the fortnight, and then slowly with the progress into 1 month, like that. So it takes a lot of work from both our side and also from the family side. So basically, these people are not used to accountability initially. They want freedom, but I usually ask people, what is freedom? If we say that we suspend the constitution of this country because we want freedom, what kind of freedom will that be? You know, it's chaotic.
Yeah.
So we need rules and regulations and accountability for us to make sure that you're headed towards the right direction.
Okay. Allow me to sample a comment that has come through. One of our viewers is asking, I'm always a victim of panic attack characterized by fear and anxiety. How can I overcome this, please? It has affected me since childhood. Could there be some addiction around here?
Sorry,
Panic
you just
attacks.
mentioned addiction. Where did the addiction come from?
No, I'm asking whatever they forwarded is I'm always a victim of panic attacks.
Right.
Characterized by fear and anxiety. How can I overcome this, please? It has affected me since childhood. So my question is,
Yes.
with what has been presented here from the viewer, could it be linked to a form of addiction? Or is it just an
Not
issue they need to
necessarily.
deal
Not
with?
necessarily. That could be a purely just a mental problem. And by mental problem, I mean like anxiety by itself is already a whole diagnosis. And usually anxiety goes hand in hand with depression. And for people who get panic attacks, usually that's as a result of anxiety. And panic attacks are terrible. They're very terrible because you feel like you're losing oxygen. It's like you're losing air, and the fear becomes so real. It's like the world is closing its cages on you. So best advice is for this person to see a professional, preferably a psychiatrist. And also they need psychotherapy, counseling, like to see a psychologist, just to be able to take them through, to understand what they're going through, and have some sense of self-awareness, so that when they start getting into this panic mode, so that when they start experiencing these symptoms, they are able to know how to navigate. But basically, when it gets bad, psychiatric evaluation, then medication.
Okay. Another question I wanted to ask, I'm sure you practice this every day, Michael, you know, seeing different patients coming in with different addictions and relapse. Are there success stories? Are there success stories?
You'll be amazed. You'll actually be fascinated. Of course, there are success stories. Like I'm sitting here.
Yeah.
So it's success. You also saw Mawera.
You're a guru.
The other time you're sitting with Mawera here. That is
Yes.
success also.
Yeah.
But in general, when you're looking at statistics, globally, we look at between 60 to 62 to 70% success.
Yeah.
Cases of success. And recently we were just trying to also do numbers on our side, because we do it. Usually look at how many did we discharge in 2021, how many did we discharge in 2022, and how are they so far. And consistently we've had above 70%, 75, even up to 80% cases of successful people who've been able to stick and progress back to their normal lives. And there have been some severe cases at the time of admission, but we've seen people change and transform. So that's in the affirmative.
Yes. So what are the things that keep the addicts who have success stories, what keeps them motivated to ensure they don't relapse again from practice? I know it varies case per case, but what are some of the things that have motivated them to,
I think
to stay on course?
It's the capacity and the ability to return to functionality. For me, I think that is one of the biggest motivating factors. When people look back and they see the pathetic situation of where they were at, because basically what substance does and addiction does is it sort of distorts your perception. Your interpretation of reality is skewed, it's distorted. So that's why you get people getting this, what we call psychiatric kind of symptoms, like grandiose. Grandiose is extreme pride. Like someone is convinced they've achieved things in life. You know, like, I don't need to go to Coastal, I must go to Bahamas or Zanzibar. I just need to hit this glass of a hard liquor and I'm already there. I start telling you the way I'm connected with powerful people, you know, the way I've been on TV and things like that, and yet nothing. I don't even know where JKI is, yet I tell you I'm a globe trotter. those are distorted perceptions. So you get what the person is saying, how the person is talking is completely disconnected from what is reality as perceived by everyone else. But to them, that's a sense of reality. So when people come and their eyes sort of open and they realize, oh my goodness, you know, I can be able to make something for myself in this life and become a success, and they're able to stick to that, then that is one of the most liberating and beautiful things that we've been able to witness.
Okay. And there is one thing you said in the process of recovery, that families don't trust, you know, this addict. What would you tell family members in terms of the support they can offer one of their loved ones towards helping them recover. Of course, at the beginning you said you can't recover fully. You know, it's still a journey and it's still a process. What support can the family members give to their loved ones who is recovering, and the things not to tell them and the things to tell them, like the do's and don'ts?
Right.
Yeah.
One thing okay, this is my personal opinion,
Yes.
but I think it carries weight. It's important that they're not trusted. It's important because they need accountability, and accountability means that there's proof, there's evidence of input and commitment and consistency.
Yeah.
Right? And tough love is important because the moment now you start babying these guys, then that's wrong. That's what we now call enabling. You know, you see someone coming home late, you agreed you'll be coming home by 7 or by 6 because anyway, what are you even doing outside since you're just recently out of treatment and you've not really gotten a job? You know, you can't even be traced on the phone sometimes. Your phone is off, or, you know, that's funny.
Yeah.
That's really funny. And it's just the nature of in the first stage of recovery, we've said it's the abstinence stage.
Yes.
The abstinence stage simply means that you are not taking, right? But you're still in a chronic state of mental relapse. And pause are going to look for you 1 to 2 years. Then there's the second stage of recovery. We call it the repair stage. The repair stage is now when you bounce to functionality, that you can now be given the car keys, you know, run for this errand. Your mom can now give you chapa and will not be worried whether you're going to come back home or not. You know, this is usually between 2 to 3 years. That now the amends that you are making while you're still in treatment, you know, people say, I'm sorry, you know, I'm the one who stole your money, mom, I'm sorry, I'm the one who used to sneak into the bedroom and take this. It's like your mom doesn't already know.
She knows.
You know, it's like, you know, there are people who can't even leave money on the kitchen counter, you know, because they know what is going to happen. But you've been consistent for such a long time that now when you say sorry this time, it carries weight because previously your words have been rendered empty, but now you're able to say something and it actually goes through. That is what we call the repair stage before we now come to the last stage, which is between 3 to 5 years, which is called the growth stage. Now you start developing at a personal level and being able to really move forward. So in regards to family support, at that point, it's important that there is tough love.
Tough love.
Tough love has to be there because we're not going to babysit. You're a grown-up. For how long? We've had these stories for so many over and over again. Sawa, you said you wanted a business. You wanted us to start a business. Probably someone is asking for 200K or 250K. If we give you 5K, if we give you 10K, can you manage that? Because if you're faithful with the little, you know, then that gives us some structure to be able to see how to push you to the next level. So first of all, it's relearning all the way from this baby steps and then solidifying to if we prefer people actually going back to structured places of work, not necessarily starting a business. If you can check into employment where there's a certain time for checking in and then you are paid at the end of the month, you actually
accountability,
budget and do all those things, then that would be the best thing.
Okay. As we wind up, Michael, what would you tell somebody watching us who is into addiction but doesn't want help? And the second category of person who has been relapsing, gets help, comes out, then goes back, you know, comes back. What's the danger of that in a minute before we wrap it up? Speak to those two categories. This one who knows is addicted but doesn't want to get help. The other one keeps relapsing, and seems not to be moving, no progress.
Right. The person who does not feel like they need help, they basically they lack insight. They're not aware. So I can't talk to that person. I can talk to the people around that person.
Yeah.
Get that person into treatment. There's what we call involuntary commitment, whereby someone is destroying their own lives and they're not aware of it. It's affecting everybody else except themselves. So it's important for that person to be, you know, they always know better. But the reality on the ground is very different. So that person needs help and the people around can be able to support that particular individual. The person who keeps on checking in and out, in and out, in and out. I think this is multifaceted in the sense that this person may be not necessarily having a substance use problem. There's an underlying issue. Maybe there's trauma from childhood. Maybe there's undiagnosed bipolar. Maybe there's undiagnosed depression. Maybe there's something that has not been traced. So this other thing that you are seeing is a symptom. It's not the sickness. It's not the sickness. So first of all, we may need to have the right diagnosis for that individual and get them on the right treatment and have the right structures. But if someone already has had the right treatment and they keep on going back to it, then the law of eventuality dictates that this person checks 6 feet under. There's no other treatment for that person.
That's a very tough truth, but it's a reality, Michael. Thank you. So where can people find you, those who'd want to get in touch?
Right. Just go to YouTube, look for DAV International Mental Health Hospital. We also have our website. Just go on Google, type, check us out, give us 5 stars, rate us, give us good comments. I mean, you're doing a great job, aren't we? Yeah. As in, hey, can start with you.
DAV International.
DAV International Mental Health Hospital. And yes, just check us out. We are based in Karen, near Karen C Primary School. That area, there's a place called Total, just around that area. You can also just check us on Google Maps. We're also in Kikuyu, near Alliance, Boys Alliance Girls, around that area.
Okay.
Yeah, that's where we are based.
Outside Nairobi?
Outside Nairobi, yeah, we are looking into that very soon.
Okay. Thank you. Thank you, Michael. We appreciate you for coming. And what would be your parting shot?
My parting shot is, apart from just substance use, like what we've been seeing in the news recently, people are going through things. It's a pandemic, and it's going to explode. In the next 5 years, it's going to be a bad place. And people are starting early. People are starting 7-year-olds, 8-year-olds, 9-year-olds. They're getting into things. And usually dysfunctionality usually starts at home. Yeah. It begins at home, literally starts at home.
Okay.
So it's very important for people just to seek for help. Whatever you're going through, check on a friend. Check on a friend, but the earlier we can be able to curb this thing, the better. If people are having substance use issues, it's important, just seek for help. Just seek for help. If people are feeling low, people are feeling depressed, people are acting weird, people are acting funny, it's important, just seek for help, and we are here to help.
Okay. Thank you, Michael. May God bless you for the great work you're doing. Hoping to do this again next time as the Lord avails. Wow. Parting shot is it starts at home. So what kind of an environment are you creating at home? Is it an environment that would push a loved one to go into addiction, any form of addiction? Is it an environment that would cause someone to relapse, from an addiction that they are recovering from? So please, at home, whatever it is, seek help, seek help. And of course, I like to say right here at CITAM, we have help for you. We have free counseling for you. You can get in touch and you'll get help. My name is Grace Mutiso. Wish you a blessed, blessed time. God willing, let's do this again next week, same time, same station. Of course, a different guest and a different topic. Shalom and God bless. Stand by for other amazing programs coming up, and also News Watch with, should be Kennedy Kimani, if I'm not wrong. Shalom and God bless.